Dr. Patel, my dentist keeps telling me that I need to go to for cleaning every 2 to 3 months. And he says that I have this beautiful thing called lots of saliva. And it's very healthy to have lots of saliva, he tells me. It has, however, the side effect of creating lots of plugs, lots of, it builds up. And he, of course, accuses me of not brushing long enough. I don't know how he knows that because he's not in my bathroom, but since I'm brushing only half or quarter of the time my wife brushes, he might have a point there. So what is this saliva thing and that stuff to do? So if a dentist tells us come every 2 to 3 months, is he just after my money, or does he have a point?
Well, he does have a point at times. You see lots of saliva is there. Around the back of the front teeth, the lower front teeth, there is a salivary duct which is opening, submandibular duct, through which the saliva comes. If there is an excess flow of saliva, the saliva usually cleanses the teeth, but many times the saliva is sticky. So it sticks around the teeth and it creates more plaque being accumulated. At the same time, the salivary duct comes in the upper jaw near the molars. And the most of the plaque we see on the outsides of the molars. And those are the places where we see that the patient is unable to clean. If a patient is having more saliva, those saliva sticks to the teeth and they stay there. And they are not cleaning it, but they are staying, just like stagnant water. When a stagnant water is around in a crevice, it creates those algae, it creates those things which remains and makes it dirtier at the bottom. The same principle is here. So that's why we try and clean it every 3 months, so that the patient is unable to clean it. Plaque accumulation again becomes calculus, and calculus should be cleaned every 3 months. That's why we recommend the patient don't go by your insurance, but go by what is in an individual mouth. Insurance person doesn't know that an individual mouth is different from the other mouth.
Right.
Right?
Well,
some of them are recommended every 3 months, some of them are recommended every 6 months.
Got it. So there is a reason to it, and having lots of saliva is a good and beautiful thing with a little bit of a side effect, which is a little bit inconvenient because it builds up more plaque. So that is a true statement.
Right. Those type of saliva which is sticky. The other type of saliva which we create it by eating chewing gums. We give chewing gums to the patient, we'll tell them, okay, this will create saliva and clean your teeth. And mechanically clean your teeth. And saliva will clean your teeth. Keep your mouth nice and wet. Those type of saliva is different because those are nice and runny saliva. Those are thin saliva. And this is thick and sticky saliva. So there are two different types of saliva we're talking about.
Well, all right. Thanks a lot, Dr. Patel, and we'll speak to you soon again. Lots of good information here, and I'm sure your patients and the prospective people listening to these videos will enjoy it very much. Bye-bye.
Thank you, Helmut. I did enjoy all the video series which you are doing with me so far. Thank you.
Wonderful.